Hello, I'm Dr. Chris from Center for Health Promotion and Economic Rehabilitation, CHELPA for short. Today we are discussing recognizing stroke and mini stroke. How do you recognize stroke or mini stroke? This lecture actually is meant for the general public and those healthcare providers in the primary healthcare. So it is not intended for medical doctors. So I will not be using much of medical terms like CVA or TIA. So, firstly, why do you need to recognize stroke as soon as possible? It is important because every minute counts in stroke care. So, you must be fast in recognizing stroke. About 15 million people are affected by stroke every year worldwide, and about 5 million of that 50 million die. Another 5 million are permanently deformed, while 5 million others recover. So, if you can recognize it early, you or your loved one may be among the 5 million that will recover. So, and caring for a stroke patient is a very stressful condition because most of the times, most of the times they are unhappy. So, it's difficult to care for them. So, that is important that we must recognize stroke as soon as possible. We must be fast. And the symptoms you will see before you say this patient is having a stroke or maybe having a stroke is represented by the abbreviation be fast. Be fast. The first thing is by B. B is balance. The patient will lose balance. If the patient is walking, person can fall. They have lost the balance or have dizziness as they want to fall. That is the first thing. Then the next one, the E, be fast, BE. The E is the eye. The person can have a kind of blurring of vision. Then the most important of the fast, FAS. The face will not be equal. If you tell the patient to smile, the one part of the mouth will deviate, which shows can be a sign of stroke. Then the arms will be unequal. If you tell the patient to raise your hands, one part of the arm will be weak. You will not be able to raise the arms equally. Then the S stands for speech. The speech, if you tell the person to make a sentence, the speech will be slurred. It will be slurred. It will not be well coherent and well pronounced. Cannot pronounce words accurately. So once this happens, the T stands for time. It's time to act. So the time to act, if it is where you have emergency services, you call emergency services, ambulance services immediately. Yes, in Nigeria now, the FCT has a number for ambulance services. I will put it in the screen so that you can call, if you're in FCT, you can call the ambulance services, or if somebody can drive you to the hospital. The person that is having symptoms of stroke should not be the one to drive to the hospital. You cannot drive yourself if you're the one having the stroke symptoms. Then the difference between stroke and mini stroke is that the symptoms are the same, but for mini stroke, the patient recovers. Just for a short while, the patient recovers. So mini stroke is like a warning stroke. So whether you have a mini stroke or you have a full stroke, you need to see your doctor because mini stroke is a warning. So if the patient is not attended to, the person can have a full stroke. So